I am Yulia, and I am 34 years old. I often feel ashamed discussing sexual health, especially about HPV testing, possibly due to family taboos surrounding the topic. However, I recognize the importance of addressing it openly.
Gaining more hormone-related knowledge about sexual health can empower individuals and foster better communication, ultimately leading to healthier relationships and informed decisions.
Please tell me, I read that you recommend imiquimod for treating condylomas. I was diagnosed with HPV 2 years ago. I treated the condylomas on the skin in the groin and near the urethra with Aldara. Almost all of them disappeared, and the viral load decreased. The remaining ones near the urethra were cauterized with Solcoderm 2 times. After 3 months, the condylomas appeared again, also near the urethra, on the skin in the groin and now inside the vagina. Will a second course of Aldara help? And could they have grown again due to cauterization with Solcoderm? Thank you.
Yulia, if the first treatment was effective, then the second course should also be effective, only this time extend the course of treatment, but not more than 16 weeks. Solcoderm does not cause a relapse of condylomas. If you have had sexual relations, pay attention to whether there are similar growths on the penis of your partner. If so, then it is necessary to undergo joint treatment.
Hello, please tell me if there is anything in common between condylomas in a husband and candidiasis in a wife.
Maria, a connection may appear if, against the background of candidal vulvovaginitis, you also develop these growths. Partners must interrupt sexual relations if one has condylomas until they are fully cured. This viral disease typically spreads through sexual contact. You should undergo an examination by a gynecologist, and if you do not have condylomas, undergo a course of antifungal treatment.
In 2012, doctors diagnosed me with HPV type 11, which initially showed no symptoms. Previously, I'd only been diagnosed with cervical erosion and no other diseases. However, this year an examination revealed the presence of cervical condylomas. I believe this is due to my significantly reduced immunity after a long treatment for kidney inflammation. Cytology results came back clear, indicating nothing unusual. The doctor prescribed cyclosporin for both intramuscular and vaginal use. I did 2 courses with a 10-day break. After another examination, the doctor said there were fewer condylomas and the erosion was less severe. Now I have been prescribed yarrow, celandine and tampons with aloe and honey, sea buckthorn tampons. Please tell me how effective this treatment is. Is laser removal of condylomas necessary, or can they be treated with medication? Can papillomas appear on the face and body now? Can the virus go dormant again and not manifest itself? And what else needs to be done for this?
Human papillomavirus, HPV type 6 or 11, most often cause the growth of condylomas in the anogenital area. Laser exposure is the most effective and gentle method of treating condylomas in nulliparous girls. Conservative treatment, like yours, cyclosporin, can also be effective. You cannot consider further therapy, such as douching with yarrow and celandine, or using tampons with aloe, honey, and sea buckthorn as an effective treatment for condylomatosis. Therefore, it is only possible to predict the result of your treatment with a specific understanding of the problem. Skin papillomas have no connection with them located on the genitals. The best prevention of them is their removal, and if they recur, imiquimod cream, not Indian.
I visited a gynecologist for a routine checkup and the doctor discovered cons on both walls of my vagina. I wasn't aware of what type of HPV I had, so I took tests for the type, anaplasmosis, mycoplasmosis, and other infections. Now I'm anxiously waiting for the results. My husband and I have been living together for 11 years and we're planning to have a second child. What should I do now? I read a lot on the forums and don't know what to think.
First, don't be nervous and wait for the hormone test results. Sometimes doctors confuse the wavy structure of the vaginal mucosa and growths in the form of condylomas. They most often form on the external genitalia. If you doubt these are cons, visit another gynecologist to confirm this diagnosis.
How to get rid of them in the intimate area? You need to see a gynecologist who will recommend a treatment method depending on their number. This can be laser removal or chemical cauterization, Ferezol or Condyline. You can use Imiquimod cream at home. It is applied to the skin 3 times a week, every other day at night and only to the skin. The effect of the treatment occurs in about 4 weeks. Hello! I have condylomas on the outer and inner labia, but I do not know if there are any inside. If you treat patients for the papillomavirus, what HPV test method can you use to remove them? I appreciate any help you can give me. I read extensively about sexual health online, but I know the internet can sometimes be misleading.
Yes, I treat cervical, vaginal and vulvar pathologies in outpatient and inpatient settings. In particular, laser radio waves with argon plasma ablation treatment of diseases and cons, too, of these localizations. Patients travel from other regions for hormone treatment, but we make test decisions only after thorough examinations, so it is misleading to promise anything in advance. To subscribe to more stories on this channel, please click on the subscribe link. It's free to subscribe and get more shared stories. We love to share them as we can see that around the world we are often sharing the same health concerns. Also, if you subscribe today, you will receive a personalized Friends and Channel coupon voucher for 20% off any laboratory product or discount on each test or appointment during your channel subscriber lifetime. And don't forget, please show your appreciation and hit the like button so we are motivated to create more shared stories for everyone.